Imagine being trapped in your own body month after month, facing heavy periods that leave you physically drained. Now imagine finally getting a break, only to start bleeding again in between those periods. Imagine the constant pressure on your bladder, making you run to the bathroom every hour. Some of us can only imagine this agony, but for millions of women around the world, this is not imagination. This is daily life. This is life with uterine fibroids, an often overlooked, yet incredibly common condition affecting up to 80% of women by the age of 50. Have you ever felt like your period was more than just normal? Share your experience in the comments below. Let's break the silence together. What exactly are uterine fibroids? Uterine fibroids, also called leiomyomas, are non-cancerous growths that develop from the muscle tissue of the uterus. They're made of the same smooth muscle fibers as the uterine wall, but they grow in a disorganized, tumorous fashion. They can be as small as a seed or as large as a watermelon, and they can grow inside on or even outside the uterus. While fibroids are not typically cancerous and don't usually increase your risk of uterine cancer, they can significantly impact your quality of life depending on their size, number, and location. Symptoms that could be signaling fibroids. Many women don't even know they have fibroids. But for others, the signs are hard to miss. Heavy, painful periods that last longer than usual, bleeding between periods, a sensation of fullness or bloating in the lower abdomen, frequent urination due to pressure on the bladder, constipation, low back pain during sex, and even difficulty urinating or emptying the bladder. Have you experienced any of these symptoms? Let us know. Your comment might help another woman feel less alone. Can fibroids affect fertility or pregnancy? Yes, but not always. Fibroids can interfere with fertility depending on where they're located. Those that grow into the uterine cavity can affect implantation. During pregnancy, fibroids may enlarge due to hormone changes, potentially causing breech presentation baby in the wrong position, preterm labor, or a need for C-section delivery. That said, many women with fibroids still get pregnant and deliver healthy babies, especially with proper monitoring and treatment. Who's most at risk for fibroids? While we don't yet know the exact cause of fibroids, several risk factors have been identified: higher body weight, early menstruation, late menopause, a family history of fibroids. Not having children. Women of African descent are also statistically more likely to develop fibroids and at an earlier age. Let's talk solutions. How are fibroids treated? Medical options include hormonal birth control, IUDs and NSAIDs. Surgical options: myomectomy, surgical removal of fibroids, hysterectomy, removal of the uterus. Uterine artery embolization, cutting off blood supply to the fibroids. MRI-guided focused ultrasound radiofrequency ablation important. A hysterectomy should not be the first or only option presented. Always get a second opinion if that's the case. What about natural and herbal treatments? Herbal remedies are gaining traction in fibroid management. Some of the most researched options include green tea extract. Studies show it may shrink fibroids and reduce symptoms. Vitex balances hormones and may help regulate the menstrual cycle. Turmeric, anti-inflammatory and antioxidant properties, may slow fibroid growth. Milk thistle supports liver detox, helping your body manage estrogen levels better. Dandelion root also supports estrogen metabolism and liver function. Black cohosh helps reduce uterine inflammation and cramping. These herbal remedies should always be used under the guidance of a qualified herbalist or healthcare provider, especially if you're on other medications or trying to conceive. Final thoughts: you're not alone. Uterine fibroids can feel isolating, painful, and overwhelming, but there is hope and there are options. Whether you choose medical treatment, surgery, or natural approaches, what matters most is that you feel heard, supported, and empowered. Talk to a provider who listens. Don't settle for one-size-fits-all solutions. Now it's your turn. Have you or someone you know dealt with uterine fibroids? Did herbal remedies help you? Are you struggling to choose the right treatment path? Drop your thoughts, stories, and questions in the comments. Let's create a powerful space for education and healing. Like this video. Don't forget to like, comment, share, and most importantly, subscribe for more videos on women's health, pregnancy, fertility, and natural healing.